Behçet's disease is a rare chronic multi-system inflammatory disorder. It causes blood vessel inflammation throughout the body. This can lead to a wide range of symptoms affecting various organs. The disease is named after Hulusi Behçet, a Turkish dermatologist who first described the condition in 1937. Behçet's can be challenging to diagnose due to its variable symptoms and lack of a single diagnostic test. Behçet's disease is considered a systemic vasculitis, meaning it affects blood vessels of all sizes. It can manifest in individuals of any age, though it is most commonly diagnosed in people in their 20s and 30s. The disease is more prevalent along the historical Silk Road, a region stretching from East Asia to the Mediterranean. However, it can occur in people of all ethnic backgrounds. Understanding Behçet's disease is crucial for effective management. Early diagnosis and appropriate treatment can help control symptoms and prevent serious complications. While there is no cure for Behçet's, various therapies can significantly improve the quality of life for those affected. Living with Behçet's disease often requires a multidisciplinary approach, involving specialists from different medical fields. This collaborative approach ensures comprehensive care addressing the diverse manifestations of the disease. Patients benefit from working closely with their healthcare team to develop a personalized treatment plan. Behçet's disease presents a diverse array of symptoms, making it a complex condition to diagnose. One of the hallmark symptoms is recurrent oral ulcers, similar to canker sores, which can be painful and frequent. Genital ulcers are another common symptom, often appearing on the scrotum, vulva, or vagina. These ulcers can be painful and may leave scars. Skin lesions can vary in appearance from acne-like eruptions to erythema nodosum, characterized by red, tender nodules, typically on the shins. Eye inflammation known as uveitis is a serious manifestation that can lead to blindness if left untreated. Joint pain is also a common complaint affecting various joints including knees, ankles, wrists, and elbows. Gastrointestinal symptoms can range from abdominal pain and diarrhea to more severe complications like intestinal ulcers and bleeding. Vascular complications can involve inflammation of both arteries and veins, potentially leading to blood clots and aneurysms. Neurological involvement is less common but can manifest as headaches, meningitis, or even stroke. The unpredictable nature of Behçet's disease adds to the diagnostic challenge. Symptoms can come and go with periods of flares and remissions. The variability in symptom presentation makes it essential for individuals experiencing these symptoms to seek medical attention for a thorough evaluation. Diagnosing Behçet's disease is often a complex process due to the lack of a specific diagnostic test. The diagnosis relies heavily on a combination of clinical findings, patient history, and exclusion of other conditions with similar symptoms. The International Study Group criteria are commonly used to aid in the diagnosis, requiring recurrent oral ulceration plus at least 2 other characteristic manifestations. The ISG criteria consider various symptoms including genital ulcers, eye lesions, skin lesions, and a positive pathogy test. The pathogy test involves pricking the skin with a sterile needle. A positive result is indicated by the development of a small pustule or papule within 24 to 48 hours. However, the pathogy test is not always positive in all Behçet's patients. The absence of a definitive diagnostic marker makes it crucial for clinicians to carefully evaluate patients presenting with suggestive symptoms. Differential diagnosis involves ruling out other conditions such as lupus, Crohn's disease, and multiple sclerosis, which can share similar manifestations. The diagnostic process may require consultations with specialists from various medical disciplines. The challenge in diagnosing Behçet's disease underscores the importance of a comprehensive medical evaluation. Patients experiencing recurrent oral ulcers, genital ulcers, eye inflammation, or other suggestive symptoms should consult a healthcare professional for proper assessment and guidance. The exact cause of Behçet's disease remains unknown, but research suggests a complex interplay of genetic and environmental factors. Certain genes, particularly HLA-B51, have been associated with an increased risk of developing the disease. However, having the HLA-B51 gene does not guarantee that someone will develop Behçet's, indicating that other genes and environmental triggers likely play a role. Environmental factors, such as infections, are suspected to contribute to the development of Behçet's in genetically predisposed individuals. Some studies suggest that certain bacterial or viral infections may trigger the onset of the disease or exacerbate existing symptoms. However, further research is needed to definitively identify specific environmental triggers. The complex interplay between genetic predisposition and environmental influences makes it challenging to pinpoint the exact cause in individual cases. Understanding the genetic and environmental contributions helps researchers develop targeted therapies and preventive strategies. While the exact mechanisms triggering Behçet's remain elusive, ongoing research continues to unravel the complex interplay of genetic and environmental factors. This research holds promise for identifying potential targets for future treatments and ultimately preventing the disease. Section 5. Treatment strategies for Behçet's disease. Currently, there is no cure for Behçet's disease, but various treatment options are available to manage symptoms and prevent complications. Treatment strategies are individualized based on the specific manifestations and severity of the disease. Medications are used to control inflammation, suppress the immune system, and alleviate specific symptoms. Corticosteroids are often prescribed to reduce inflammation and manage acute flares. Immunosuppressants such as azathioprine and cyclosporin are used to suppress the overactive immune system and prevent long-term damage. Biologic therapies like TNF inhibitors target specific inflammatory pathways and can be effective in treating severe manifestations. Topical medications are used to treat oral and genital ulcers, providing local relief and promoting healing. Colchicine, an anti-inflammatory drug, can help reduce the frequency and severity of oral and genital ulcers, as well as joint pain. Eye drops containing corticosteroids or other anti-inflammatory agents are used to manage eye inflammation. The choice of treatment depends on the individual's specific symptoms and the severity of their disease. Regular monitoring and adjustments to the treatment plan are essential to ensure optimal control of the disease. Section 6. Managing complications and prognosis. Section 7. Lifestyle adjustments for Behçet's patients. Section 8. Current research and future directions. Current research in Behçet's disease is focusing on understanding the underlying causes and mechanisms. Scientists are exploring genetic factors, immune system abnormalities, and environmental triggers. New treatment options are also being investigated, including biologic therapies that target specific components of the immune system. The future looks promising, with ongoing clinical trials and collaborative efforts worldwide aiming to improve the lives of those affected by Behçet's disease. Section 9. Living with Behçet's, a path forward. Living with Behçet's disease can be challenging, but with the right support and management, individuals can lead fulfilling lives. It's important to work closely with healthcare providers to develop a personalized treatment plan. Staying informed about the latest research and treatment options can empower patients to make informed decisions about their care. Support groups and communities can also provide valuable resources and a sense of belonging. Section 10. The importance of ongoing medical care. Ongoing medical care is crucial for managing Behçet's disease. Regular checkups with healthcare providers help monitor the condition and adjust treatments as needed. Early detection and intervention can prevent complications and improve outcomes. Patients should not hesitate to communicate any changes in their symptoms or concerns with their medical team. Consistent and proactive care can make a significant difference in managing the disease effectively. Section 11. Conclusion. Hope and support for Behçet's patients. There is hope and support available for those living with Behçet's disease. Advances in research and treatment are continually improving the outlook for patients. Support from family, friends, and healthcare professionals plays a vital role in managing the condition. Remember, you are not alone in this journey. Together, we can work towards a better future for all those affected by Behçet's disease.